Good morning, my examiner. I am candidate number B22-001-004. I am here for my practical examination.
The examiner will now give the student the complaint that she will manage. Mrs. Agnes, a native Obowo, came to your clinic with the complaint of inability to pass stool, abdominal fullness, discomfort, and flatulence. She is aged 66 years old, retired teacher. The student is expected to create effective rapport with patient.
Good morning, madam. You're welcome to our clinic. My name is Adis Favor, and I will be attending to you today. I assure you that everything we discuss will be kept strictly confidential. Please feel comfortable to talk to me freely.
The student is expected to open the appropriate section, page of the standing orders, and takes the complaint.
I would like to ask you some questions so I can better understand your condition. What exactly is the problem you are having? For how long has this problem been present? Have you experienced nausea or vomiting? If yes, how many times do you vomit in a day? Do you have constipation? Do you find it difficult to pass stool? If yes, when did you last pass stool? Do you have diarrhea? That is your stools watery? If yes, how many times have you passed stool in the last 24 hours? In your stool, have you noticed any blood? What is the color of your stool? When you eat, does the abdominal fullness get better or worse? Or does it remain the same whether you eat or not? Do you have any pain in your abdomen? If yes, could you please point to the exact location? Is the pain continuous or does it come and go? In the last 6 months, have you noticed any worms in your stool? Do you have fever, especially at night? Have you taken any medication or visited any health facility, chemist, or traditional healer since the symptoms started? Is there any medicine your body does not accept or that causes a reaction to you? Do you have high blood pressure? Do you have diabetes?
The student is expected to wash their hands and dry it. The student is expected to perform all clinical examination as written in the standing orders because the student is assessed for competency in the use of equipment and in recording.
While interacting with my patient, I observe her face for any signs of discomfort, paying attention to her expressions. I also examine her eyes for signs of pallor, which could suggest anemia, and for jaundice, which may indicate liver problems. I proceed to measure her blood pressure, following the standard clinical guidelines, ensuring she is seated comfortably, arms supported at heart level, cuff of the correct size, and reading both systolic and diastolic pressures accurately. I record the results immediately. Next, I request privacy for the patient and move with her behind the screen. I explain the procedure to her before starting. I perform an abdominal examination, inspecting all 9 regions for any visible abnormalities, such as distension or scars. I gently palpate each region, checking for tenderness, swelling, or pain, and noting any guarding or rigidity. I also percuss and auscultate if needed. I then check for the presence of umbilical, inguinal, or scrotal hernias. Following this, I examine the anus for prolapse, fissures, redness, or any other abnormalities, explaining each step to the patient to maintain comfort and dignity.
The student is expected to make appropriate clinical judgment and take appropriate actions.
From my general observation, the patient appears restless. On abdominal inspection, I note visible distension. On palpation, The abdomen feels hard with generalized tenderness in all regions examined. Based on these findings, I assess the patient to be in a moderate condition. My provisional impression is constipation, pending further investigations to confirm the diagnosis and rule out other possible causes. Based on my assessment, I advise the patient to increase fluid intake daily to help soften the stool and ease bowel movement. Eat more fruits and vegetables, which are rich in dietary fiber and aid digestion. I gave her liquid paraffin 10 milliliters. This will be on for up to 1 week to help relieve constipation. Deworm at least once a year with albendazole, 400 milligrams as a single dose to prevent intestinal worm infestation. I explain the purpose of each recommendation and ensure the patient understands how to follow them. I also advise her to return to the clinic if symptoms persist, worsen, or if she experiences new symptoms such as severe pain, blood in stool, or fever.
The student is expected to give appropriate health education.
From what I have found, here's what I will advise you to do at home. 1. Drink enough water every day. Try to take at least 8 cups of clean water daily. For example, you can use your regular drinking cup and aim to finish 1 cup every 2 hours during the day. This will help soften your stool and make it easier to pass. 2. Eat more fruits and vegetables. These are easy to find in our local markets. For example, you can add pawpaw, watermelon, oranges, or garden eggs to your meals and include vegetables like ugu, spinach, or water leaf in your soups and stews. 3. Do moderate exercise. You don't need a gym. You can walk around your compound, do light sweeping, or take a 15 to 20 minute brisk walk in the morning or evening. This movement will help your bowels work better. 4. Avoid using laxatives too often. Some people like to take strong purges frequently, but this can make your stomach depend on medicine to work. Only use what I have prescribed, like liquid paraffin, 10 milliliters when necessary, for up to 1 week. 5. Deworm yourself once a year. Use albendazole 400 milligrams as a single dose. You can get it from a licensed pharmacy. This will help prevent worms that can cause stomach problems and poor digestion. 6. Practice good food hygiene. Always wash fruits and vegetables before eating them. Making sure food is cooked properly. Cover your food to protect it from flies. 7. Maintain good personal hygiene. Wash your hands with soap and clean water before eating and after using the toilet. For example, if you use a pit latrine or water closet, always wash your hands immediately after. This will prevent germs from getting into your body.
The student is expected to give follow-up advice.
I would like you to come back to the clinic in 1 week's time so we can check your progress and make sure the constipation is improving. If everything is fine, you can continue your normal routine. But if the problem is still there, we will do further checks. Please don't wait until your appointment date if you notice severe or worsening stomach pain, blood in your stool, persistent vomiting, high fever, or weakness. In any of these cases, return to the clinic immediately, even if it is at night or during the weekend.
The student is expected to return all the equipment.
My examiner PLs let me return all the equipment I used. The reason for returning and properly handling all equipment is to prevent the spread of infection to myself, other patients, and health workers. Please do not forget this health card when coming for your next appointment.